Welcome back to Hannity and Colmes. I'm Alan Colmes. We're discussing alcoholism and what causes a person to become an alcoholic. Is it a disease that's genetically based, or is it a character trait that is socially or environmentally acquired? With us to discuss the topic are Stanton Peele, the author of The Truth About Addiction and Recovery, and Dr. Douglas Talbott, the president-elect of the American Society of Addiction Medicine. He's in Atlanta, Georgia. Mr. Peele, there's so many scientific studies that show a link between people's genetic makeup, between their heritage, between their background, and between alcohol addiction.
Things in that same basket, their heritage and their
All right,
genetics.
let me, because a lot of different studies show a lot of different links. You know who Jim Milam is?
Jim Milam, yeah.
Milam, okay. Clinical psychologist who has written books on the issue. Let me show you what Mr. Milam says. He says that Stanton Peele is a liar. He's in total denial of science and has been completely shut out of the scientific community.
Jim, I want you to give my best regards as well. I debated Jim Milam in front of the NIAAA. They asked me to come and invite them, so maybe he should complain to them and tell them that they shouldn't invite me anywhere. But people do, unfortunately or fortunately, listen to my ideas. In fact, the field of addictive medicine and addiction and alcoholism has changed very much in the direction that I have been recommending for 20 and 30 years now, starting in 1975 when I wrote Love and Addiction. For example, we found that it doesn't do the best to treat everybody as though they're an alcoholic. 80% of the people who have drinking problems, like the young man who's arrested for drunk driving, don't do well by being brought into a room, being bombarded with the idea that you're an alcoholic, you've been born to be an alcoholic, you can never drink again for the rest of your life. Most of those people do better by being made aware of the consequences of their behavior. Alan, and this is what really depresses me, as a liberal, do you know that most
don't
people—
point at me and call me a liberal like that.
Most people who end up in alcoholism treatment today don't come in and say, I've got a real bad problem. What happens is they get arrested for driving drunk one time, they're brought into a treatment center, they said, you're an alcoholic. The guy says, I don't think I am. They say, you know what they tell him, Alan? They tell him, you're in denial. We're going to drug test you and urine test you and make sure you never drink again, because that's what we've decided that you are.
Dr. Talbott, please do.
I want to jump in for a minute. First of all, I want to recognize the tremendous contribution that Dr. Peele has made and
well, now
to
you're
the
ruining
field.
a whole program. You're getting along.
I may be ruining that, but I wanted to make two points.
Kidding.
One is that there's Dr. Peele recognized that Noble and Blum in 1990 talked about the genetic link of D2 dopamine and the receptor site, and there has been a seminal paper that was just published by Noble in April and March of '96 in Scientific America on this genetic link. And I think we all agree now that there is a genetic link. And the other thing, that nobody is looking at people who have too much alcohol and calling them alcoholics without doing a very careful assessment to determine whether they're alcohol abusers, which is a social, cultural problem in which patients do have control, versus the addiction.
Do you think that every treatment center is doing that kind of careful diagnosis in your experience?
Well, they certainly should be, because people shouldn't be brought in without a careful evaluation to distinguish abuse, which is a social cultural problem, from addiction, which is the biological genetic
I don't know
disease.
if you want to really link yourself to that Ken Blum study, though, Doug. There's been other studies which have totally refuted that.
Well, I'm not talking
We'll pick this up when we get back, and we'll also take your phone calls. Hold on, Doctor. We'll come back in just a moment. We'll also take calls from you at 1-888-TEL-FOX. So stay with us on Hannity and Colmes.